And then they're moving on to these other drugs because, well, it wasn't that bad. Well, certainly it is that bad because now we have people dying. We have a community that's rallying together because, you know, it's an epidemic. It really is. And it's not East Lyme. It's not Stonington. It's not Ledger. It's a community as a whole. It's every single one of us that's dealing with this.
Dr. Michael Savage, a National Radio Talk Show host, who's a trained biologist and botanist, has emphasized marijuana is toxic, and people don't seem to really fully understand that.
Well, you know, again, I certainly don't have those qualifications, but I've seen people that have smoked marijuana for years, and I've seen the effects that it takes on their body, similar to, you know, somebody that's smoked cigarettes for years. Obviously, it takes its toll. There's different effects, different side effects. But, you know, we refer to it in the police field, oh my God, that guy's burned out. You know, we talk to somebody, oh, he's burned out. Been smoking marijuana his whole life. You know, no long-term memory, just got, you know, the things that you would expect to happen when you're 75 or 80 years old or 90 years old are happening at 45, 50 years old because you've abused your body for that long. And that's with a semi-natural substance like THC. These other things, as she just said, there's synthetic heroin out there now. The things that it's doing to your body is amazing. It's absolutely catastrophic. And people either don't see that or don't care to see that. And that's the problem that we're running into. You know, we say a lot that there's no respect for human life. There's certainly no respect for your own life. You know, and if you can't respect yourself, then you can't respect anybody else. And that's a problem that we have.
And that's where the addiction comes in. The addiction, sometimes it is not the person so much behaving in that way, but that addict inside that person that is forcing otherwise good people or otherwise people that would not behave the way they behave into behaving the way they behave. And that was a good segue to talk about this register now for the 7 great myths of marijuana for the Ledgelight Health District thing, which we have information on. But we talked about the addiction and the effects on the family. And that's really, there's effects that go far greater than just on the addict. It spreads out through the family. And I don't know if there's anybody else that would like to say anything. Yes?
Hi, my name is Diane, and I work at Flanders Elementary School. Both my kids have gone through East Lyme. They're both graduates. And I'm here as a parent because this is real. My son, who just turned 18 a month ago, just admitted himself into a treatment center last night. And a lot of things came out, and he's in detox right now. It just started. I'm on my way up there after the meeting. He admitted he's been on heroin for 2 years, every day. My son is one who always made money, always, since he was little. So he always had money. So it's definitely not for the poor. It's those that have a lot of money, and he will tell me that. He has had chronic pain in the past, which has led us to go into the hospital several times, where you're put on Dilaudid and different meds that are very heavy, and then you're just excused. And he started with pot, then it went to pills. His recent visit to Children's Medical Center, they sent him home with Klonopin. Klonopin is I just learned all this stuff yesterday, that it is harder to get off of than opiates. Crack cocaine, which I really don't know all about drugs, but crack cocaine and heroin, that kind of thing. So I am here to tell you it's real. Definitely watch kids that are insecure about themselves. That was one way that he could show up at a party with all sorts of things and be the life of the party. And then you find out later that those really weren't your friends. So it does reach out to the family. I'm dealing with it right now. And whatever I can do to be on a committee to help, because I know it reaches many families, and you don't always see it. We didn't see it. We had suspicions. We thought, oh, it's probably just pot. Okay, pot. Okay, that's the least of our worries. Oh, it could be this, it could be that. But you can't, some would argue, but dragging someone to a treatment center, everything I've learned is if they don't want to go, they're just going to leave, and it's not going to take effect. So my prayers right now for my son are, he is 18. He could walk out that door in Middletown, and we hope he makes it through the 10 days of detox. And then you go into rehab, and that's the next step. So it is real, and it is in East Lyme. and it's everywhere. And my son will tell me that Mom, I can drive up to Hartford and get it. I can drive to New London and get it. I can get it right here in East Lyme, Mom. You have no idea. You have no idea. They're parents. And I'm like, can you just give me some names? Because I wouldn't do that, because, Mom, addicts don't ever reveal their sources. So it is real, and I just hope everyone pays really close attention to it. So.
Well, thank you so much for your courage to come up here today and talk about that. One of the things that perhaps could come out of this is maybe some type of family network, a parents network, a family of brothers and sisters that can come together outside of the professional organization and support each other, similar to the way that Al-Anon or AA do, and when you're in the rooms and you gain support from each other as you go there. So perhaps that's something that may develop out of this, and that could be a good thing too. I've been kind of saving you, Rhonda, a little bit to talk about what the state is doing for the department. We're going to watch a little tape, but we talked about the addiction. We talked about some of the things that are happening. You heard the sergeant talk about the effects of somebody when they're on that high, or the withdrawal or whatever from that high. And there are some drugs that can combat that. Narcan is a drug that is used to kind of get people instantaneously from this heroin high down to normal. It actually saves lives. It can reverse the effects of it and bring people right back and prevent overdose and prevent death. There are some legal questions that the legislature is wrestling with in terms of the Good Samaritan laws and what can happen if you give somebody something and something happens. What is your intent? What can happen? So I'd like to talk a little bit about that and bring that up, and perhaps anything else that you may want to talk about. Please, Rhonda Kincaid, who is the regional manager from the Department of Mental Health and Addiction Services, and they've been very supportive to all of our cities and towns through the state. Thank you to the commissioner and to you for your presence today.
Well, and thank you for your work, and thank you. I don't know where you went. I want to thank you also for having the courage to share. I don't remember your name. I'm sorry. I have short-term memory just because I have short-term memory. But putting a face on recovery is part of what we talk about in terms of helping people realize that this is something that, the statistics would show that 1 out of 4 of all of us in this room are affected in some way by addiction, either in our own family, ourselves, a friend, a loved one. So it's not something that people tend to talk about. So I appreciate that. Our department, as you probably know, funds and provides a number of prevention, intervention, outreach, treatment, education, recovery support services for people with mental health and substance use problems. One of the things that we've gotten very much behind is educating people about Narcan. It's estimated that every day in Connecticut somebody dies from an opioid overdose. That could be from heroin, it could be from OxyContin or some other kind of prescription medication. And we are very, very firm in our belief that knowing about Narcan will help people save lives. It's only one piece of the puzzle. We have law enforcement, we have education, we have youth efforts, we have parent efforts, we have prevention, work like Ledgelite and CIRAC. But this is something to know about that could maybe help you help a loved one. The Narcan is a prescription medication that reverses an overdose. And so if you are experiencing overdose, you're not capable of administering it yourself. And so in 2012, the legislature passed a law that said that any prescriber in Connecticut can prescribe Narcan for use for somebody who is believed to be having an overdose. And there was some protection in that law that protected that prescriber from any kind of civil suit or criminal prosecution. There is, in this legislative session, a law was passed, I believe it actually goes into effect October 1, that extends that protection to anybody who actually administers the Narcan. So if you have a loved one If you know of somebody who is using or is in early recovery or is in recovery, could be still at risk. EMTs now, can carry this, first responders, family members. You can ask your family physician. Anybody who is a prescriber can prescribe this, and you can have this available. I saw some statistics in New York, don't quote me exactly, but there were over 700 overdoses that were responded to, and I think all but 20, the Narcan was effective in reversing the overdose. We have a DVD that the department made. It's only 10 minutes long. It talks about how Narcan works, how you would use it. I want to warn you, it does have some fairly vivid simulations of people using drugs and alcohol and how someone would respond to an overdose. But the information, I think, is really key for people to be aware of. It's on our website. If you go to demas.gov, Google us. We have a whole page of information on Narcan and links to a variety of resources in terms of where you can get Narcan, more information about it. We have our community call line number there if you want to know more about it, if you want to get a prescription and you can't find someone, we'll assist you. And I'll try to answer any questions after the video.
It's a precious life, don't let it go. I might have been a man and I told you so. I won't waste a single tear, a single year, facing all my fears. I see you running cause you want some more. Burned out, no feeling, hope is gone. I won't waste a single tear, a single year, facing all my fears. And it feels like a tomorrow.
This is John. John has had a heroin habit for years, using 10 bags a day. He was just discharged from a 5-day detox. Instead of going to his outpatient appointment, he decided to get high just like before. But what John failed to realize is that his tolerance has changed. He is now overdosed using the same amount he used before because his body is readjusted to not using at all. His breathing is slowing down, and there isn't enough oxygen getting into his system. This is Mary. Mary likes to party and mix different drugs. Mary has mixed prescription medications with alcohol. The combination can be deadly. Opioids are depressants, which on their own can cause overdose. But mixing them with drugs like OxyContin, Vicodin, Valium, or alcohol is even more risky. As with John, Mary has overdosed. This is Jose. His dealer told him that the heroin he bought is really strong, so he doesn't want to overdo it like the others in the room. He leaves and decides to mix it with some cocaine to balance it out. Jose is making 2 mistakes. First, he is taking a drug he purchased off the street of unknown quality and strength. It could be much stronger than what he is used to and what he's developed a tolerance for. Second, he believes that taking cocaine and heroin together will cancel out the chance of an overdose. In fact, mixing the heroin, which slows down your breathing, with the cocaine, which causes you to use more oxygen, puts a terrible strain on your body. Most fatal overdoses are the result of mixing combinations of drugs. The girl that Jose was talking to is Jane. She could be at risk for an overdose if she has other health problems, such as AIDS, asthma, kidney, liver, or cardiac disease. She's going off to use by herself, but using alone puts her at an increased risk if she overdoses. All of these individuals are at risk for overdose. What are the factors that increase their risk? Decreased tolerance due to a change or break in use, using alone, mixing different drugs together, especially opioids with benzodiazepines and alcohol, using street drugs of unknown strength, or swapping one prescription pill for another when they may have different strengths, having other health issues that compromise or weaken your system, having a previous overdose, which suggests a risky pattern of use, using IV drugs or smoking, and being older. Could these people be saved? Yes, they can. To understand how, we need to see what is happening inside their bodies. These are the opioid receptor sites in your brain. Right now, the opioids these people used are bound to these sites. One of the effects of this binding is that breathing is depressed, but it doesn't usually stop all at once. Eventually, the heart and brain are deprived of sufficient oxygen and the person dies. But the reality is that the process usually takes 1 to 3 hours, and most people who have overdosed are not alone. This means that in most cases, intervening and saving the life of a person overdosing on opioids is possible. In fact, this is now happening in many places around the country. In Connecticut, a law was passed in 2012 allowing prescribers to write prescriptions for a drug called naloxone or Narcan. How does naloxone or Narcan work? To answer this question, we have to go back to the brain. When naloxone or Narcan is administered, it has a greater affinity for the opioid binding sites than heroin or other opioids, so it removes them and takes their place in the receptors. The Narcan actually reverses the effects of the opioid, and typically the person is revived within a few minutes. So, if you think someone has overdosed on opioids, what do you need to do? John's friends notice that his lips and fingernails are blue and he's barely breathing. They try the sternum rub with no response. They slide him to the floor and start the rescue breathing. Someone calls 911 while another friend returns with the Narcan kit from her car. The Narcan is administered and the rescue breathing continues even after it has been administered. After a minute or so, John is revived. The person probably won't realize that they overdosed. They just wake up dope sick and sometimes agitated as a result. It is possible that they could re-overdose based on how much they used and how long the Narcan lasts. Do not let the person reuse opioids. Back at the party, a similar situation is happening to Mary. She is unresponsive, she is still breathing, and her heart is still beating, but something is terribly wrong. How do you decide if what you are seeing is an opioid overdose? All overdoses are not the same. An overdose on a stimulant like cocaine isn't the same as an overdose on opioids. Naloxone or Narcan will only work on an opioid overdose. Signs of such an overdose include the person is unresponsive or unconscious, shallow breathing with a rate less than 10 breaths per minute or no breathing at all, blue or gray skin, especially the fingernails and lips, loud, uneven snoring or a gurgling noise. If an overdose occurs, there are 4 steps that should be taken. Number 1, call 911 and say that the person is not breathing. Number 2, put the person in the recovery position if you are alone with them and have to leave for any reason. This is to avoid them choking if they start to vomit. Number 3, start rescue breathing, which involves putting the person on their back, tilting their head, and lifting their chin, giving 2 normal-sized breaths, and then 1 breath every 5 seconds. Check to see if the breaths are going in. Do this until they either revive or emergency medical services arrive. Number 4, administer Narcan. Narcan can be administered in different forms. The most common are the intramuscular and the intranasal. There is no need to worry about Narcan being abused. It is not addictive and has no street value. It will not harm a person who does not use opioids. The law that was passed in Connecticut allows you to get a prescription for this life-saving medication. All you need is the proper training and a filled prescription.
So this is something that we feel very strongly about, that we hope that people will pass the word, get information about. If you're in a position where you think that You may be in a position to have a loved one, a family member, a friend that you suspect might be using. It's fairly inexpensive. I don't have the exact cost. I've heard everything from $15 to $25, but it's not a prohibitively expensive prevention tool to have.
So you don't have to be the user to go get this. You can be a
Correct.
family member. You can, what do you do? Go to your doctor and ask for a
You
prescription?
can go to your
right the
family,
phone?
actually, your family practitioner, an APRN, a dentist. I mean, any doctor or nurse, APRN that can prescribe in Connecticut can prescribe this.
So find somebody you trust, somebody you can talk to that you want to
Right.
share your situation, and then you have this on hand, and they'll train you how to use it.
They should be able to train you how to use it, and we also we brought a few brochures. There probably aren't enough.
I passed some out.
And you can see, some of the training is there in the video. But your family practitioner should be able to tell you, the information that you need for this. And we know that there are some pharmacies that aren't stocking it yet. If you can't find it, on our website we have prescriber locators. And again, we have our community call number on our website, so that if you can't find a pharmacy for some reason that is stocking it, we'll try to assist the best we can to help you find one.
But you do have a website, you said, and the best
We do have a website, and
is it?
it's.
Yeah,
I
don't think it's on.
it's not on there,
No.
but it's just demasct.gov or something.
So-
Google it.
so-
I should know it by heart, but
Well,
I have a direct link to it on my computer.
Let's say it may be DMHAS, which stands for the Department of Mental Health and Addiction Services,
Right.
DEMAS, at ct.gov. If that doesn't work,
It's probably
connect with me.
.ct.gov
Huh?
or /ct.gov.
If that doesn't work, connect on our website, eltownhall.com, and I'll kind of work with it. I'm going to ask.
We can make sure you get a link to it on
I'm
your
going to
site.
make sure, I'm going to ask the department for more literature here, that we can kind of use town hall as a place to put literature out for you, so you can just come in and grab it. I started putting out meeting schedules for AA and NA. They've been out in the lobby, and they get picked up on a regular basis, so we do have a very active recovery program, a 12-step recovery program here in Niantic and East Lyme and in Flanders, so you can find out that if you need somebody. And we all know people that can be sponsors to people who are interested in recovery. So if you're in day 1 or 2, please let me know, and I can probably connect you with some of those folks that may want to help and participate in your day-to-day recovery from this. So that was awesome. That was great. What else do you want to talk about?
The only thing I can think to mention is our community call line. It is on the website, but if anybody want to jot it down, it's 860-418-6962. So if you're looking for services, if you're looking for information, like I said, about where to find somebody to prescribe Narcan, please, give us a call. We'd be glad to try to help. So, thank you.
So I was telling Rhonda how great Carmen is being our IT guru. She's already got our website up here for DEMAS, so that's what it is, and you can take a look at it if you want. What else? Anybody else want to talk about anything? We've learned a little bit about the problem is certainly prevalent. It's in cities, it's in towns, it's in the state, it's in the nation. It's probably international by all that we know. We've heard from our professional enforcement community about what can happen, about where it is, what people end up doing and not doing, and how busy we are as a result of that. And we've heard from some of the recovery and prevention programs that are out there. And we've heard from the school people that are very interested in getting this information out, and then certainly from our Park and Rec department in our state. So is there anything else that anybody else would like to share? Please come to the microphone if you wouldn't mind, so I can get you on tape. We are going to play this tape back for people in the town to watch, because it is, our cable access channel is one of the most watched cable access channels. I don't know if you know that. I just made that up. Yes.
I just have a question, and it's really probably addressed to law enforcement primarily. How are drugs getting into our country, and basically what can we do as people on the street, basically helping you to combat this problem?
Probably have to go up there, Bill. I'm sorry, I don't get you on the tape. And if you have the answer to that question, Bill, that we can answer in a minute, you're going to be the chief law enforcement agent in the country, I think.
Obviously, the country, the federal government, Coast Guard, FBI, Drug Enforcement Agency have been waging this war on drugs, as they've called it, for a number of years. There's thousands of ways that these drugs are coming into our country. The drug cartels have made significant gains in getting material over to this country. There's a lot of homegrown stuff. I don't know if you've ever seen specials. They've made submersible submarines, unmanned drone boats that have very, very low profile in the water, mules. There's 1,000 different ways that they can smuggle this stuff in. They're smuggling it in because there's a demand. There's people here that want it. If there was nobody that wanted it, if everybody was like you and I, then it wouldn't be coming in. There'd be no market for it. So there's always going to be a demand. They're always going to find new ways to get this in. They were doing plane drops in North Stonington several years ago. We were going out there. They were dropping bales of marijuana in via plane. They find ways that typically law enforcement don't have the assets or aren't expecting to get these things in there. So we need to educate ourselves as law enforcement officers to find the ways that they're getting these things in there. And I think with the resources that federal, state, and local law enforcement have, we do an adequate job. We don't do a good job. We do an adequate job of finding these things. Like I mentioned before, our canine officer does a lot of interdiction stops and gets a lot of drugs. But there's probably 70% that is getting missed. That it's just one of those things that sometimes you get a good hit, sometimes you don't. Sometimes there could be a lot that goes right under your nose that you just don't know about. So.
And we've talked a little bit about families. We've heard about families, and it's noticed and not noticed. And I want to talk about Chris Olson, who is a security officer at at the school district, and had a wonderful forum a couple of weeks ago on mental health and how do we support mental health. This is all kind of connected. It goes even to the gun control situation. Mental health is really the basis of what we're talking about. And mental health in one area, mental health causing addictions, mental health causing violence. So, we have these forums, and now we have this opportunity to move forward. Chris is spearheading a great program about bringing together different organizations that have different focuses on all of this, and these are some of the things that we're doing in our community. And what you have to, I think, is to know your kids and know your family members. And, the days of getting off the school bus and having mom or dad there every day are dwindling for a lot of people in this country that are working two jobs, that are too busy, or a lot of single parents that are just unable to do that. So it's important to understand and talk to your kids, and I think that's the biggest thing, and that's why I think we have such a great school system, because they promote parental involvement, and I think that's the way we got to start, and that's why everybody's here. So we're at an hour. I'm happy to go as long as you want to go. Does anybody else like to say anything or add or subtract anything? Yes. I was hoping you were going to get upset, but I wasn't going to call on you. I promised you I wouldn't call on you.
So my name is Sarah. I'm here from the Hartford Dispensary.